let's talk about coronavirus. No, this is not like the flu. The flu kills at a rate of 0.1%. COVID-19 kills at a rate of 3.5%, which makes it more than 30 times more deadly. Now, experts have maintained that there are 3 key ways to fight off a pandemic virus: washing your hands, social distancing, and cutting interest rates. Now, with social distancing, let's refer to everyone's favorite historical example, the 1918 Spanish flu, which killed around 100 million people. And that was before we had commercial airlines flying all over the world. Now, the Spanish flu of 1918 can really be summarized as a tale of 2 cities, Philadelphia and St. Louis. In 1918, Philadelphia ignored the warnings about the flu and threw a parade, which drew 200,000 people. 3 days later, all 31 hospitals in Philadelphia were filled with sick and dying patients from the Spanish flu. Now, St. Louis, within its first cases, closed down schools, playgrounds, libraries, courtrooms, shut down social gatherings of more than 20 people. This is what the experts talk about when they refer to social distancing. What I'm worried about most is the burden on the healthcare system that this is going to create. The country of Japan has 13 hospital beds per 1,000 people. The United States, we have 2.7. which puts us 32nd in the world, just behind Turkey. Turkey. Let's take a look at the total cases right now. This is the total number of cases in Italy up to 4 days ago. Now here's the total number of cases in the United States so far. If we line them up to be exactly 10 days ago, our curve looks remarkably similar to that of Italy. This is 10 days ago. This is where we're heading. Yeah, that Italy. The same one where they're deciding who lives and who dies because they have lack of hospital beds. But don't worry, that'll never happen here. They have more beds per 1,000 than the United States does. Look, just because coronavirus is in the news every single day, that doesn't mean that heart attacks, strokes, and other traumas are just going to take the next 6 months off. This is why it's so important for us to do what every single news organization is talking about right now, and that's called flattening the curve. Flattening the curve has less to do with preventing illness and more to do with slowing down the rate at which people are getting sick. We just don't want a massive spike, because it's during that big spike when our healthcare system gets overrun, and that's when we're deciding between who's living and who's dying. That's what's currently going on in Italy. They are going through their spike. So instead, what we want to do is flatten the curve. I think to me, what the most evil part of this virus is how symptomless it is before you get sick. The incubation period is actually really long. You can have the virus from 5 days to 2 weeks without any symptoms. Meanwhile, you're walking around spreading the virus from person to person, and only then do you get sick. This is why the people who are going out and partying because they feel like they can't get sick have the completely wrong idea.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
Just because you're young and you're healthy doesn't mean that you can't transmit this disease to the bartender of the bar that you're YOLOing at. And then he transmits it unknowingly to, let's say, an older person who's at a very high risk. So instead, just stay in, watch Contagion, and chill. Which, by the way, can we talk about how good that cast is? I mean, it's directed by Steven Soderbergh, and it stars Matt Damon, Lawrence Fishburne, Jude Law, Goop, Kate Winslet, Bryan Cranston, John Hawkes, and Dimitri Martin. This movie's actually really good.
Stop touching your face, Dave.
Anyways, what am I most worried about? I'm really worried that our economic incentives aren't lined up with our health and medical incentives. Economics always wins in our current society. And so I'm super scared that we're not going to close businesses soon enough. Some cities have started closing restaurants, bars, and schools, but it's not happening quick enough. We really need to be taking aggressive steps right now. We shouldn't be delaying school closures until someone at the school gets sick. By then it's too late. The experts say that you should close down that particular school if even one person gets sick in the geographical area. Not wait 7 days until you're going to have to close it anyways. Preventative school closures have a dramatically better effect than reactive school closures. People keep telling me that we shouldn't be worried because Italy has a much older population, which is at a higher risk. But there's also another group of people that are high risk. Those are people with obesity. Italy only has an obesity rate of 19%. The United States, 36. West Virginia has an adult obesity rate of 44%. What happens when the coronavirus really takes foot there? West Virginia just had their first COVID-19 case last night. Another thing, people keep talking about China and how greatly they reduced their cases. Yeah, I'm not surprised an authoritarian regime was able to knock down their cases drastically, but we're not China. Okay, now what are some good that can happen out of this? This can act as a dress rehearsal for an even more serious virus, something along the lines of a bird flu with a spread rate of that of the coronavirus. We can also be taking steps now to help prevent our healthcare system from being overrun. The fact that we only have 2.7 beds per 1,000 people in this country is terrifying. We should definitely be increasing the number of hospital beds we have in this country. That's such an easy fix. The sad reality is, people are already starting to lose their jobs. Companies are starting to lay people off. I know people in Seattle that lost their jobs yesterday morning. This is real. So let's just take the next couple weeks and chill. So please, stay at home, wash your hands, buy as much toilet paper as you can financially afford, and quit touching your face.
I mean, she's overreacting, right?
Not really. And stop touching your face, Dave.